while most of you use a computer mouse for work. My tool of choice is needles. I've performed over 10,000 procedures with needles, yet I've never answered the question, why are people afraid of needles? My name is Monika Wishwa, and I am an aesthetic medicine doctor from Krakow. I'm making this video because too many people are afraid of needles for us to just ignore it. That's why I asked you in a poll here on the channel whether you're afraid of needles. A quarter of people answered yes, a quarter said it depends, and half said no. It's shocking that as many as half the people on this channel have some kind of problem with needles, and it's not just on this channel. I found a meta-analysis which determined that among young adults around the ages of 20 to 40, about 20 to 30% experience a strong fear of needles. That's why in this video, we're going to settle once and for all why we're afraid of needles and how to overcome this fear for good. The fear of needles, also known as trypanophobia, is not a trivial issue and can actually pose a real threat to your health. How exactly? Imagine avoiding an important blood test or vaccination just because the mere thought of a needle makes you feel faint. According to research, the average healthy person will receive 165 injections over the course of their lifetime. If someone has a phobic fear of needles, every such situation is a huge source of stress for them. As a result, many people avoid contact with healthcare, postpone doctor visits, or put off tests that require injections. Estimates from the same study show that as many as 16% of adults forego vaccinations precisely because of this fear, and that can actually shorten their lives. So even if you never undergo any aesthetic medicine procedures, you will almost certainly have your blood drawn or have an IV inserted in a hospital at some point. That's why you should definitely watch this video until the end, because you never know when this knowledge might come in handy. Where does the fear of needles come from? According to research, the fear of needles often begins in childhood. As many as 80% of people in this study who struggle with a fear of needles say that their first symptoms appeared before they turned 18. Honestly, that doesn't surprise me at all. I grew up in the 90s and I remember from my childhood that my aunt or uncle would say things like, if you don't put on your hat, you'll have to get shots. Or, if you don't eat, we'll go to the hospital. Most likely, these people were just repeating what their own parents had said a generation earlier. Besides, for several years after college, I worked at a health clinic. At least once a week, during an appointment, a parent would scare their child with me in the office. Every week, I would hear something like, calm down or the doctor will give you a shot. So from my own experience, I know that scaring children with needles and the doctor still happens today. Speaking of my experiences, now I'll tell you how the issue of fear of needles looks in an aesthetic medicine office like mine. Patients often comment and warn me about their fear of needles. Some people are so afraid that they faint after the first injection. And if they don't faint, they experience panic, a sense of losing control, anxiety, heart palpitations, or excessive sweating. In short, it's a great deal of discomfort on many levels at once. For many people, aesthetic medicine procedures are extremely stressful, not because they're worried about the results, but precisely because they're afraid of needles and pain. By the way, is fear of needles the same as fear of pain? It turns out it's not. It might seem that a patient suffering from a fear of needles is actually afraid of pain, and that eliminating the pain would solve the problem. But it's not that simple. Yes, pain does play a big role in this fear, but that's not the whole story. In a global survey, almost all respondents with a fear of needles, over 95%, indicated that the fear of pain from an injection increases their anxiety. However, only about 37% considered pain to be the most important factor in this fear. And what about the rest? For most respondents, something else is even more frightening. General anxiety and stress related to the procedure, negative mental images, and even the sight of the needle or blood itself. There is also often a fear that something will go wrong during the procedure, for example, that the nurse might make a mistake. In other words, the fear of needles is not a fear of pain. It's a phobia, which means the reaction is often irrational, so even people who are resistant to pain can feel panic at the sight of a syringe or needle. So if you're afraid of needles, it doesn't mean you're sensitive or timid or that you can't handle pain. Exactly. Often, after talking with patients, I come to the conclusion that they're more afraid of needles than of giving birth, which is the ultimate confirmation that it's not about the pain. Alright then, so what is it really about? In other words, what's happening in your brain when you experience this kind of irrational fear? The first thing we need to refer to is childhood trauma. Being scared by the idea of a doctor is one thing, but if as a child you had a traumatic experience with a needle, like a very painful injection or the shock of being pricked, such trauma can resurface in adulthood. The studies I just showed confirm that this phobia often stems from one or several bad experiences piling up, leading the brain to learn that a needle equals danger. And even when, later in life, we become mature and are guided more by reason than by emotions, such a phobia can be so deeply rooted that it cannot be rationalized or, even more so, controlled. The limbic system, particularly a structure called the amygdala, is largely responsible for the fear response. It's our threat detector. When it recognizes something potentially dangerous, it triggers an alarm throughout the entire body. For someone afraid of needles, even just seeing a syringe or thinking about an injection activates the amygdala, which sends a signal, attention, danger. Importantly, this signal can be triggered even against our will. It's an automatic reaction. What's important is that the brain of someone afraid of needles exaggerates the assessment of danger. A needle is treated as a serious threat, even though rationally we know the harm is minimal. After all, we know that the nurse drawing our blood won't hurt us, right? Or that an aesthetic medicine doctor performing a procedure on you won't hurt you either, right? Interestingly, genes may also be responsible for trypanophobia, which is the fear of needles. Genes associated with a tendency to faint at the sight of blood or needles have been identified. Fear can also run in families, meaning that if parents were afraid of needles, there's a greater chance this will be passed on to their children, as we've mentioned several times today. An interesting fact about this phobia is what happens in the autonomic nervous system when we feel fear. First, the fight or flight response is activated, controlled by the sympathetic nervous system. Our body produces adrenaline, the heart beats faster, blood pressure rises, and the muscles tense up, preparing us to flee or to fight. This also happens at the sight of a needle. A sudden surge of stress hormones prepares the body for an expected attack. But be careful. In people with a strong fear of needles, an unusual secondary overreaction of the vagus nerve sometimes occurs. After the initial adrenaline surge, there is a sudden inhibition. The heart slows down, blood pressure drops, and the blood vessels dilate. This is the so-called vasovagal reflex, which causes a person to suddenly turn pale, feel weak, and possibly faint. In other words, the brains and nervous systems of people with needle phobia swing to extremes. First comes panic and arousal, then a reflexive shutdown of incoming stimuli through fainting. Why am I talking about this? It's because I want to show that the experience of someone with a fear of needles is exceptionally unpleasant. Not only mentally, due to the panic fear, but also physically, because of the body's uncontrollable reactions. Alright, now you know all the theory behind what causes the fear of needles. Now it's time for practice, how to tame this fear. The good news is that there are specific things you can do that will definitely improve your relationship with needles and injections. Here they are. First of all, don't look at the needle, don't watch as the doctor prepares for the procedure, draws up the medication, and so on. Where should you look instead? It's best to just close your eyes. I've seen hundreds of times how much this helps. Secondly, breathe deeply, evenly, and rhythmically. A calm, deep inhale and a calm, deep exhale. You might be surprised at how much your body's response can change when you start breathing consciously. You can also ask the doctor to remind you to breathe because you might forget yourself. Thirdly, regarding communication with your doctor, if you have a fear of needles, let your doctor know in advance. Some patients find it helpful when the doctor explains what they are going to do because it makes them feel safe. Other patients prefer if the doctor doesn't say anything and works in silence. Agree in advance on what works best for you. Fourth, consider local anesthesia. There are lidocaine patches that, in theory, you can apply beforehand to make the injection less noticeable. I say in theory because I've seen hundreds of children at the clinic with these patches during vaccinations, and it never helped more than average. However, if you feel that knowing you've done something to reduce the pain might help you, then such a patch won't hurt. I don't know if it will help, but it certainly won't do any harm. Fifth, sugar. Eating something sweet before the procedure raises your endorphin levels, which are the happiness hormones. Endorphins also have the property of relieving pain, which means that in theory, you'll feel less discomfort during the injections, and in addition, you may reduce the risk of fainting. And speaking of which, sixth, if you tend to faint at the sight of needles, I have a pro tip for you to help prevent fainting easily. Learn the applied tension technique, which involves deliberately tensing your muscles. This involves tensing large muscle groups, your legs, glutes, abdomen, and arms, firmly for a few seconds before and during the injection, and repeating this several times. This raises your blood pressure and prevents it from dropping suddenly, which helps to avoid fainting. And finally, seventh, if your fear is extremely intense and, for example, poses a threat to your health, it's worth seeking help from a specialist. A psychologist or psychiatrist may use cognitive behavioral therapy, which teaches new ways of thinking and reacting, or, if necessary, prescribe tranquilizers for use during procedures. Remember, if you have a strong fear of needles, it doesn't mean you're weak. As you learned from this video, a lot of people really struggle with a fear of needles. The good news is that this fear can be overcome, and it's worth fighting it, because overcoming it could one day save your life. Dear ones, I hope that with this video, I was able to help someone face their fear of needles. If you learned something interesting from this video, please leave me a comment for reach so that YouTube will show this video to more people. I also found out that recently YouTube introduced a boost this video option in the comments section, which you can also use to show appreciation for my work. But that's not all. If needles still aren't your thing, I've recorded a separate video where I talk about the best laser treatments in aesthetic medicine. That is, how to take care of your skin's quality without needles. The thumbnail for that video is now showing on the screen. I warmly invite you to check it out. Thank you for this and thank you for watching my videos. See you in the next one. Kisses?